Aloha! I'm Dr. Catherine Taketa-Wong. I'm very excited about our event for today. So, at today's event, you're going to be learning about a cutting edge approach to psychiatric treatment that goes beyond pharmaceutical drugs. Dr. Erik Shipley is here with me today. He's a neuropsychiatrist, and he considers medical issues as well as the mental emotional ones when it comes to helping his patients. So, we'll get started in just a moment. For those of you who are joining us and are new, you know that our personal office, my personal mission really is to heal the sick by finding and treating the underlying causes of conditions so that the symptoms are no longer present. And I'm really excited to have Dr. Shipley here with us because he really ascribes to that same philosophy of really trying to identify and treat the underlying causes of what could be going on with psychiatric conditions. As a naturopathic doctor, personally, I can write prescriptions for drugs, but I would rather write them for herbs and healing food. And being a Chinese medicine expert also gives me a whole different set of system. And as a healer, my passion really is to educate and empower as many people as I possibly can about how to become healthier and happier. Healthier people, happier world, right? And so, as I mentioned, Dr. Shipley really ascribes to this philosophy of looking at the whole person. And for me, my specialty is the medical treatment of autism, ADHD, and other special needs. I also treat many tough adult conditions. And we also have two other doctors at our practice who specialize in women's health, autoimmune conditions, weight loss, and other complex conditions. So we don't take new patients without, we want to make sure that it is a good fit. So the contact information is on our Facebook page if you have any questions where you would like to talk with me about working with me. And we also have information, and we'll be putting in the post about Dr. Shipley, about his clinics and his website, so that you can be able to contact him in his office if you have questions about being able to see him as well. So Dr. Erik Shipley is board certified in child and adolescent psychiatry and general psychiatry, and he is a specialist at Brain Health Hawaii. He treats disorders such as anxiety, depression, autism spectrum, trauma, and many others. And it's really the way that he does it that sets him apart. There are two basic specialties that deal with mental and emotional conditions. There are psychologists who largely will use talk therapy, and doctors, and typically prescribe pharmaceutical drugs to alleviate symptoms. Now, while Dr. Shipley does that when necessary, he also incorporates advanced brain health techniques and considers the role that a patient's medical issues could play. For example, things like dysfunction in the gut or hormone imbalances can affect the brain. And Dr. Shipley is going to explain how patients can be helped by TMS, which is something called transcranial magnetic stimulation. TMS is an advanced cutting-edge technology that uses magnetic fields to stimulate the nerve cells in the brain that are involved in mood control and many other things. We have some mutual patients, and I have seen for myself the impressive results of TMS. So again, Dr. Shipley, welcome, and thank you so much for joining us today. We really appreciate having you here.
Thanks for having me. Excited to be here.
Yeah, and so most psychiatrists typically only use medications or pharmaceutical drugs in their treatment protocol. So I'm just curious, how did you become interested in alternatives?
Well, I like to think that, I guess I'm part of a newer generation of physicians in general, and me going through medical school the last decade and then residency training, there's been a little bit more awareness of, maybe there's more to the story of someone's mental health and just overall happiness than what medications can address. So I guess in that sense, I just kind of got lucky and I was born at the right time. But that shift has really just started. And so there still is a general, I hate to say push, but just most of the coverage of topics when it comes to our education really does have to do with not only medications, but also the neurotransmitter model for how mental health kind of starts to become an issue, and then therefore how it can be treated. So I guess just like any other practitioner, I think that Western medicine looks at problems based on their theory or model of how to help them. So I think in that sense, it's just kind of where we've been. Talk therapy to begin with, starting back in the Freudian days, and that's evolved quite a bit with the therapies and cognitive therapies, and they have their roles. And actually, initially, when I applied to residency for psychiatry, I chose the residency that I went to because that was the one that had the most exposure and training in the talk therapies. So it's kind of unusual to get as much training as I did in residency. So, and that was really because I felt that, as much as medications can be helpful, it just didn't really make sense to me that would be the whole story. And I really started to recognize that when, and even in a lot of the studies, it shows that, that they're effective sometimes, but not all the time. And, as a provider, we want to help all the time. So there was just, inherently a gap of care that I wanted to fill in with some newer modalities. So I just kind of, I don't know if it's serendipity or what, or luck, but ended up in some clinics that looks at the well-being or mental health with some different tools. And so over the last few years, we've been kind of honing and shaping and figuring out how we can use those tools to help more people.
Yeah, great. And so in your practice, what are the treatment approaches that you use besides drugs?
Yeah, so besides drugs, we use a combination of a little bit of talk therapy, but big thing that we do is really looking at first identifying what's going on with the brain's kind of understanding, rather than looking at it from a neurotransmitter standpoint, which is a little bit harder to test for in the person that's alive. We actually use an EEG for brain mapping. It's kind of like the EEG. The technology is really similar to the EEGs that are used to detect seizure activity, for example. But the way that we use it is called a spectra EEG. We just say brain map for short. But what we get to look at is really brain rhythms. This idea of when you meet somebody and you're like, gosh, I really feel like we're on the same page. We just vibe at the same frequency. It's been a pleasure for me to be able to map so many people and start to notice that, wait, there really is a rhythm that our brains beat to, much like an EKG shows how a heartbeat goes, how the heart's electrical system is going. We can use an EEG to look at brain beats, if you will, or brain rhythms, frequencies, different words for the same thing. And when we start to look at the brain in that way, we'll look at 19 regions. And at any given time, those regions could be talking at the same frequency or at different frequencies, or at too slow of a frequency, too fast of a frequency. And we've been starting to identify what a more ideal, healthy brain electrical activity should look like. And then deviations from that is what we try to fix with things like magnetic stimulation.
Yeah. And could you talk a little bit more about the TMS, the transcranial magnetic stimulation? As I mentioned, I have seen a number of patients that have really benefited from TMS. So could you talk a little, just in brief, about how it works?
Sure. I think I love metaphors. Starting with the metaphor that the brain's electrical activity and all the neurons in the brain cells are beating at a certain frequency, much like a symphony. So we look at 19 regions of the brain. A symphony may have 19 sections to the entire, for all the musicians. And within each section, there's a number of musicians, just like every brain region has many, many neurons. We hear music from a symphony when all the sections and all the musicians are playing at the same speed, and of course playing the same song, and the instruments are in tune. But when we start to hear some deviations, maybe somebody falls asleep or somebody gets a little too excited and plays too fast. We pick up on that distortion, and that sounds like noise. It very quickly doesn't sound like music. And so once we can identify what parts of the brain are making noise, what parts are making music, we can use, remember that's electrical activity, we can use magnetic energy in order to basically gently ask the brain to beat at a certain speed. So the magnetic stimulation is really like a conductor to a symphony. Oh, that guy's kind of falling asleep, let's kind of wake him up a little bit. And, oh, that one's going a little too fast, let's slow it down a little bit. Right? And so the full name is repetitive transcranial magnetic stimulation, because we're repetitively generating a magnetic field over someone's skull, and so that it would be asking at a certain rate for the brain's electrical activity to synchronize. And so once we can help someone's brain achieve synchronous electrical activity, we see a lot of problems that people experience as or label as sensory problems, difficulty with racing thoughts, difficulty with letting go of thoughts, irritability, fatigue. A lot of these problems start to just kind of go away, and almost all the time without the use of medication. And the nice thing is, what's been also really interesting is that for those customers or patients or clients that come to us with these complaints and they're already on medications, we've been able to help them come off of medications. And even more fascinating, sometimes people start to get side effects to their medications once we start doing the magnetic stimulation. You have to think, oh, what's going on there? And that, what we found is that is a great signal for, oh, it's time to come off the medication, because it's almost like puzzle pieces. You know, you change one puzzle piece and suddenly the other puzzle piece, like medication, can't fit like it used to. And it's like, oh, well, maybe I'm not supposed to fit here anymore. Maybe we're actually treating the underlying issue that the medication may or may not have been helping with. And so now somebody can be more medication free.
Yeah. And that's so exciting. And just wanted to see, in terms of with the conditions that you treat. I mean, you mentioned, I know that TMS, I believe, is approved for depression. I've seen it help with patients with autism, anxiety. But could you talk about, some other conditions that you have seen it be helpful for?
Yeah. So in Hawaii, we have a large, military presence. And so we actually treat a lot of PTSD in that population, mostly related to combat. And when they come home, they have a really hard time adjusting back into normal life. What we'll see on the EEG, on the brain map, is an overactive sensory system. It's like pulling in too much information. And at the same time, an underactive prefrontal cortex, which is your brain's responsible for not only processing thoughts, but also being able to go, okay, that thing that I'm feeling doesn't have to do with what's going on now. It has to do with something that happened in the past, and I'm going to let it go. In other words, to be able to go, there's not actually a threat around me. And in fact, what's happening is that my mind is kind of acting up right now. And I need to be able to let that experience go. That process, when it doesn't work well, we'll see it on the brain map. We'll see overactive sensory system, underactive prefrontal cortex. And that combination is what we find most associated with PTSD symptoms. So what we eventually do is magnetic stimulation will stimulate at the middle point, kind of like middle activity rather than too high, rather than too low, for the whole brain region. And when we do that, we start to quiet or wake up the prefrontal cortex while quieting down the sensory cortex. And one thing that we like to do is to combine this with some lifestyle changes and enhancing somebody's sleep quality. And so what we've also noticed is that when we start to help someone with their sleep quality, there's a number of ways to do that, then the response to magnetic stimulation not only is better, but also we start to notice that we're kind of giving back to somebody their natural healing processes. But I think you do a lot of work with sleep as well. And so, yeah, I guess there's more to it, but that's for PTSD. ADHD, we also see it improve quite a bit, and then concussions as well. And we've been, it's not only in the history, but also on the brain mapping. And, sometimes we're kind of left wondering, well, how much of what standard psychiatry was trying to treat was actually, things that were downstream or complications of untreated concussions.
Right.
Because the other big issue in medicine in general is that we don't have good treatments for concussion. And again, I guess it's luck or something, but it seems like the approach that we use with TMS, with the brain maps, it does seem to help people with concussions. And so sometimes we'll get parents that bring in their kid, and they think that, oh, something must be happening in their social life. They're 13 and they're hitting puberty, and suddenly there's all these changes, and that's a narrative that we've had for a long time. People start to go through changes at different points in their lives. But what we also may find out in that appointment is that their soccer league allowed them to start to use headers at that age. And now there's a lot more headers at practice and during games. And then we started to see these acute changes. And so put on our hats and go, well, maybe there's something going on with these repetitive head impacts that's causing an electrical imbalance, that if we can rectify that, then they're actually going to do much better with puberty, their social transitions, and homework and all that. So it's been interesting because I guess in a way, sometimes we call it, we're fishing more upstream before all the fish go down here and turn into all sorts of things, right? Anxiety and depression and all that. We come up here and try to fix some of, sometimes we'll call it car work. We all have our own individual desires and hopes and dreams. And that's just who we are, our relationships and people that we love. But depending on how your car or your brain and body is operating, you're going to have a different experience of life. And so trying to attend to the car then later helps to improve general, and also outcomes for things like talk therapy. And that's been another rewarding thing to see.
Yeah, and that's so great. And I think you touched on some of these things already, but could you talk a little bit more about the advantages to the patients in using non-drug therapies?
Yeah, I mean, a big thing is it's much better tolerated. It's on label, FDA older, but there's been plenty of studies that have shown that it's safe in young people as well. And so, for a lot of kids, they don't want to take things like stimulants for ADHD because it changes their personality. It makes them feel quiet. It can suppress appetite, lead to insomnia. But if we can help them with magnetic stimulation, then they don't need to be on a medication every day, and they start to, and they have fewer side effects. So I think that's one of the main benefits. But I think bigger picture, it gets to a common root cause issue of things that we later call ADHD.
Yeah.
So we get to cover more bases that way too.
Yeah, and it's really exciting. So, and then I'm just gonna pause really briefly, and then just remind our viewers that if you want to contact Dr. Shipley, then we have information in the post on his website, and so you'll find that we'll be adding a few more things to the post afterwards. And also, if you want to talk with me, then you are welcome to just call our office, and you can schedule a no-charge phone consultation with me. And I find that some patients do call and talk with me after viewing a video or two or visiting our website. So all of our contact information is on our Facebook page. And I also just like to remind our viewers that we did found an online supplement store that I founded as a fundraiser for special needs children. And all the vitamins, herbs, and supplements at our online supplement store are tested for purity by independent labs. There's a 20% discount. And our store does have all of the proceeds go to helping children with special needs families with their cost of their child's treatment. The store is on our website at drtaketa-wong.com. That's drtaketa-wong.com, and then you'll find information in the post as well. So just getting back to our interview with Dr. Shipley, I know it's been really exciting for me as a practitioner to see a psychiatrist and a neuropsychiatrist who's really open-minded about a lot of different things. And we were talking about the gut microbiome and things like that. So, and it's been really exciting as we coordinate care. I know from my side, a lot of times I'm checking for a whole bunch of different things, looking at, for example, toxins. Are there gut imbalances? Are there nutrient deficiencies? And those kind of things that we need to be able to do to help with addressing, again, trying to figure out, okay, what's going on, shifting diet or other kinds of things. I also do acupuncture that's focused on really helping with a lot of mental emotional symptoms. And it's been really nice to be able to coordinate care with some of the patients. And I know you're very well educated about the gut microbiome and the effect that it can have on the brain. And in fact, you talked about really focusing on the gut microbiome. I believe, was it in residency?
Yeah, that was my grand.
Tell us a little bit more in terms of the kind of things that you've seen with patients when we address the gut microbiome and how that can affect their mental health.
Sure, and I think that the model that I was raised in, I suppose, trained in, is the Western medical model, and we think about some of the branches of the nervous system, and really what comes, the gut microbiome imbalances that lead to symptoms or difficulties that come through my office, which may be different for somebody that's a nutritionist or some of the other folks that you may see. People come to me because they're chronically stressed. People come to me because they're having a difficult time with their energy and their fatigue and their quality of sleep, and they just generally feel like something's off. And so in my practice, one of the ways that I look at it, the main way that I look at it is, how can we help someone's gut to feel more relaxed and to engage the parasympathetic nervous system? And so we know that the vagus nerve is responsible almost completely for regulating the parasympathetic nervous system, and most of its connections are in the gut. We also know that the sympathetic nervous system and the parasympathetic nervous system, so flight, fight, fright, freeze, and rest and digest, these are like interlocking gears where if one goes down, the other one has to go up. And if the other one goes down, then the other one goes up. And so they cannot both be on at the same time, and they can't be both off at the same time. And what it seems like to me is that when somebody's gut is under attack, the parasympathetic nervous system starts to turn off, which means that we have this unchecked active stress response chronically. And that can have a lot of effects on people. We all know that chronic stress at work and maybe within our relationships takes a toll on us. I think most people are pretty aware of that by now. Either they read about it or they know it firsthand. And we know that chronic stress really impairs your brain's ability to grow, regenerate, create new connections, and to adapt to change. And so if our gut is under chronic stress, it can really, over time, lead to our thinking brain being chronically turned off and this overwhelming feeling of stress. And so cortisol is higher, adrenaline is higher. And so what I've noticed that it helps with the patients that I see is if we can help to maintain some peace within their gut through some sort of microbiome technique, then they can start to process much. They feel like they have more energy, and that gives them more room in the day to be able to do what they have to do to use talk therapy terms, behaviorally activate. Depression and anxiety tends to close us in. It reduces our options to engage with the world so that we can start to be more empowered and make changes that are going to be healthy now and in the long term. So when someone's gut starts to feel better, they can start to think more clearly, sleep better, and then we can start to see them engage in life more. That's mostly what I see.
Yeah, yeah, and that's great. It's really exciting. We had a mutual patient where that patient had some anxiety, and we found that there was an overgrowth of yeast or candida in the gut, and it was really fascinating that as we addressed that yeast overgrowth, and I prescribed nystatin, which is a pharmaceutical antifungal, and then seeing that when the candida got better and that was under control, and we also talked about that sugar feeds the yeast, and so that patient changed his diet where he really cut down a lot on sugary foods, simple carbohydrates, and that really helped to keep the yeast from coming back, and that we saw a difference or a shift in terms of how he was doing with the anxiety piece.
Mm-hmm.
And
Mm-hmm.
so that was so that was really exciting.
Mm-hmm.
Are there any observations that you want to share, or other cases that you could share that where you've seen really just with the whole treatment with it could be gut microbiome, or it could also be things with the TMS or any of these other things? So are there any comments that you have on either that case or other
there's
patients?
a couple specific ones, but there's a general theme that's been coming up. As clinicians, we're constantly trying to evolve, and as we see things that work for a few patients here, we want to know, how does this change my practice? Mm-hmm. And how can I approach my future new patients and their care in a way that can hopefully help them find change sooner. It's without the right treatment, sometimes you can just a lot of people end up in this cycle of medication change after medication change, or talk therapy, weekly talk therapy after weekly talk therapy, and they're not reaching the goals that they want to. So it's my long-winded way of starting with, my practice has changed recently since I've been getting this brain mapping for so many people, and it's been guiding towards a new way of looking at their condition, and it helps me to gauge how well they're going to respond to talk therapy and other treatments. And if it looks like they aren't going to respond very well because there are some findings on the brain mapping, then I'll recommend to them that we do a little bit of, I called it earlier, like car work before we go to the driver work. Because in talk therapy, whether it's couples therapy, or visual therapy, or whatever it may be, we're really helping people learn how to drive. We're not changing their car. But if someone's learning to drive, it's really nice to have four wheels that are going at the same speed. Yeah. It's nice to have an engine that's been tuned up. And so with that in mind, what I usually do, what I've been doing now is getting brain maps earlier on, maybe in the first or second session. So a recent case that came to me was a couple that was looking for couples therapy, and I was just hearing them talk and doing my initial evaluation, and I recommended that we do a brain mapping first. And what we found was that one of the individuals most likely has been affected by COVID brain. And they had COVID at one point, and they had a lot of changes neurologically, and they had a harder time thinking, harder time organizing, harder time with communication, and really felt like kind of like the world was against that person. And so you can see how those kinds of changes can really affect the outcomes of therapy. Right? Harder time communicating, harder time understanding perspective, harder time organizing thoughts. And so if I were to just do talk therapy for them, we may have lackluster outcomes, and it may take months and months and months to get to a place that could otherwise take, if we go through the right treatments initially. Our neuromodulation has been really helpful for COVID brain. As we do that first, she's starting to clear up more cognitively. She's starting to be able to understand other perspectives, and she's starting to feel like her old self again. And now I can ask the couples to do the homework for couples therapy, and things actually start to respond in a way that gives them a lot more motivation too, because the last thing you want to do is work really hard and not get the results you want. And so that's one way in which I've been kind of changing my practice to help people sooner. And there's been a lot of cases of PTSD and therapists doing EMDR with them. I think it's a good treatment, but again, depending on how somebody's car is doing, the response to treatment is going to be different. And what I've been hearing from all the psychologists that refer to our neuromodulation side, our TMS side, is that what they used to be able to achieve and what used to take them 3 to 5 years of therapy was suddenly taking them 1 to 2 months. And so to get to that aha moment, the clarity, the resolution, feeling like you can finally move on. And so, hearing stories like that, it just makes me think, gosh, okay, what can we do to help someone's car before we start to embark on the driving side?
Yeah, so that's great. So again, thank you so much. And I know there's a lot more that we could talk about. We would love to have you.
I know, we could talk for hours.
I know, we could probably have you. I'm sure a lot of people would really enjoy having you back at some point again, and we could talk more about a lot of other things that are just really fascinating. So, but for our viewers, I trust our discussion about TMS and holistic psychiatry has been useful for you. You're welcome to talk with Dr. Shipley. Again, he has his contact information on our post, but you're also welcome to talk with me personally if you have health concerns, so that you can feel empowered with your health. All the contact information is on our Facebook page. Again, please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are very competitive, and proceeds go to helping children with special needs with their medical treatment. So a link is in the post of this video. Mahalo to all of our viewers, and we look forward to seeing you again in another 2 weeks. Aloha.